voiceamerica.com.
Welcome to Crime Prevention 101 with host Susan Bartelstone. We're so happy you've joined us this weekend. Over the next hour, you'll learn the tips, tricks, and vital information that'll help you keep yourself confident and safe. Now, here's the host of Crime Prevention 101, Susan Bartelstone.
And hello, everybody, and welcome again to another show of Crime Prevention 101. And this is indeed Susan Bartelstone here welcoming you. And I'm really excited about the show today. This is the first in a series of shows that I'm going to be doing about non-traditional methods of healing. And I'm talking about healing from sexual assault, from any kind of crime or violence, from emotional or physical abuse, in fact, any kind of trauma. And I've identified 3 areas so far that I'm going to be focusing on. Healing through alternative therapy modalities, healing through self-defense or martial arts courses, and healing through creativity and the arts, nourishment, for the soul. And my feeling is that you need at least 2 of those 3 for the best kind of healing. Today, I'll be talking about an innovative form of therapy, and this is a mouthful. It's called eye movement desensitization and reprocessing, and thankfully it is abbreviated as EMDR. And this has been referred to as perhaps the most exciting psychotherapeutic development in the past 20 years for the treatment of post-traumatic stress disorder. And that has also been shortened to PTSD. And PTSD is what happens after a violent trauma. And it is debilitating. And there has been very compelling research on the effectiveness of EMDR therapy for treatment of post-traumatic stress disorder. It's being recommended all over the world by different agencies, and for those with whom it is successful, it achieves its results much faster than traditional therapy modalities. So I am just so excited to be talking to my guest today, Dr. William Zangwill, who is a highly regarded practitioner of EMDR and an EMDR trainer. But first, before I introduce Dr. Zangwill, I just have a couple of little tips and items that I wanted to talk about first. Something came my way. Someone sent me an email, and I did a show about these webmails previously, if anyone of you heard it, about the kind of scam emails that people send around to you. And this is a new one where you get an email saying that someone has been hired to kill you or to kidnap one of your relatives, and this email has a lot of personal information in it to make it appear legitimate. And, of course, they ask for a large sum of money from you in order to prevent this from happening. In other words, the killer, if you'll pay him, he won't kill you or abduct your relative. And this is just a terrifying email to get, but it's a scam. It's false. And if you get such an email, you got to file a complaint right away. The Internet Crime Complaint Center, it's called IC3, and their website is www.ic3.gov. And, this is just a terrifying thing. Threats of violence, extortion. It's totally illegal also. So if you ever get that or anyone you know gets this hitman scam, do not fall for this. I also found something I thought was kind of interesting. It's called trackmykids.com, and this is a personal tracking system. It costs about $300, and there's what they call a low monthly fee for this tracking service, and it's a personal tracking device for a child, and it looks kind of like a small cell phone, but it's not. It's light. It can be carried or attached to the child. It can be put into a backpack or a book bag or something like that. And it will track and report the current location of where your child is. And it has 3 buttons on the side to make emergency calls in case there's an emergency. And eventually you'll be able to actually preset these numbers, and eventually you'll even be able to receive calls. They're kind of working on that now. It can activate a help or an SOS signal so that you know when there's something wrong if the child can't physically let you know. And it has something called a taxi mode, where if in extreme emergencies where the child has to respond every minute. I love this idea. I think it is great, and especially in schools now, some of them are cracking down on cell phones, so this is a way to get around that. And TrackMyKids.com also has a personal tracking device for a vehicle. If you got a teen driver or a young driver, you can put this thing in the car, and you'll be able to know exactly where that kid is. In fact, you can log onto their website, and you can have a map with preset locations, and you'll know where your child is gone. And again, small and light, and it can be used in an emergency. I think this is a really good thing. TrackMyKids.com. So I wanted to tell you about that. And I also have a segment that I introduced last week, which I call There Ought to Be a Law. And this is where I get to rant and rave about the stupid things that people do and say regarding self-defense and crime prevention. And this week I'm ranting about a judicial institution. I saw an article in the paper. There was a big article about this. This happened in New York City, where I am based. And a New York City transit worker who was jumped by a group of guys, and they were trying to rob him. He was a martial arts expert, and even though he got stabbed, and he was stabbed severely, he was able to turn the tables on them and get out of the situation. But in the meantime, a bystander trying to help him jumped into the fray. This guy was doing well. He didn't know that this bystander was trying to help him, and he ended up getting killed. He killed the bystander. And originally, the police didn't file charges against him, but the district attorney brought it to a grand jury, and the grand jury did indict him, and he's now going to stand trial for murder. And, I mean, this is just craziness. This is just craziness. And one of the state senator, Eric Adams, who was also a former New York City police officer, and he visited. Now, the person on trial now, his name is Maurice Parks, and he had actually visited Mr. Parks, and he was so enraged by this that he's proposing a law that will say if somebody gets an innocent bystander killed during the commission of a crime, it's the criminal's fault, not the victim's fault, that this person got killed. So he's trying to introduce this law, and he said, and I agree with this, I don't know if it's in the spirit of the law to prosecute a victim of a crime. If he's attempting to get away from someone, and in the process he mistakes an innocent person to be one of his attackers, I think that the person charged should be the one attacking him. Now the people who caused the robbery are going to be charged with a lesser crime than the person who was the victim. And, this does not make any sense to me. And I think this is criminal, and I think that there ought to be a law against this. And I'm with Senator Adams on this one. All right? Well, now, before my guest today thinks I need therapy, I'm going to calm myself down. And I want to introduce Dr. William Zangwill to you and get to the very important topic of the impact of violent crime on victims and how they can recover. Now, his bio just amazes me when I was looking it over. Dr. Zangwill has been a licensed clinical psychologist for more than 25 years, and he's located in New York City and Long Island. And I think he's probably out near me, where I am. Anyway, he was trained in EMDR, that's eye movement desensitization and reprocessing, in 1990, and is a highly regarded practitioner of EMDR. He specializes in the treatment of post-traumatic stress disorder, PTSD. We're going to use a lot of initials here on this show, and of sexual, marital, and family problems. And he was among the first group of people that were trained to train therapists in EMDR. He worked very closely with Francine Shapiro, who is the originator of it. And he has trained thousands of therapists all over the U.S. and abroad in his methods. And he is also particularly known for combining EMDR and meditation, which we're going to talk about. He's written a lot of stuff, and he's got a great website. So, everybody, I want to welcome Dr. William Zangwill. William, welcome to Crime Prevention 101.
Susan, thank you.
It's just a pleasure to have you here today. And I know you're out in Phoenix. How is it out there?
It's really beautiful, except for the dust storms, of course, that delayed the flight coming in.
Oh,
yes, exactly.
You know, I hope you don't get mixed up with what's going on down there in Texas. That's going to be nasty.
It is indeed.
Now, you're out there presenting at a conference?
At the EMDR International Association Conference, yeah. It's a yearly conference of EMDR practitioners from all over the world.
And you're one of the speakers at the conference?
Yes.
Excellent. I bet that's going to be a very interesting conference. Now, before we start, William, I want to read a part of an email that I got a little while ago that I think is going to lead us nicely into the topic.
Please.
I have a website, DearSafetySolutions.com, where people can write to me. I've been dubbed the Ann Landers of self-defense because people can write to me with their concerns, and I help them. And I got an email a while ago from this woman. She said, I'm a 36-year-old female living in the Midwest. Having survived an attack by both a stranger and an acquaintance, I'd like to know how one goes about finding any sense of security in life. She said, I can't get past the intimidation and the fear. I was also one who froze during my assault and was unable to fight back, and I wanted to know if there's a way to combat this. This, of course, is what? Post-traumatic stress disorder, right? These are some of the symptoms.
Yeah, absolutely. It may be, absolutely.
Okay, and people need to learn how to spot these symptoms and to know that they can recover quickly if they seek help. So let's talk about it. What are some of the symptoms of PTSD?
Well, some of the things your emailer mentioned, having trouble getting past a painful event, flashbacks, vivid memories, either in the forms of daydreams or nightmares, difficulty in focusing and concentration, sleep disturbances, sometimes an increased use of substances, in an effort to numb yourself from the feelings. And it sounds like, the person you mentioned has at least a few of those.
Yeah, all sorts of really debilitating symptoms.
Exactly.
All right. We're coming up on a break, William. Let's take a quick break right now. We're going to come back and talk more about some of the ways this is debilitating and how we can help it.
News, opinion.
Can you hear me?
Your voice counts. Call toll-free 1-866-472-5787. 1-866-472-5787. VoiceAmerica.com. After more than 17 years' experience teaching safety skills to thousands of women and men, crime prevention and personal safety expert Susan Bartelstone concluded that by thinking and responding quickly, ideally within 20 seconds, potentially violent criminal encounters can be prevented. Using techniques from many different disciplines and illustrated by 60 real-life examples and success stories, Susan shows how it's done in her new book, Think Fast and Prevent a Violent Crime: How to Respond to Danger in 20 Seconds or Less. Check out www.fightsafe.com for more information. You'll also find information there on Susan's upcoming Crime Prevention 101 personal safety teleseminars. Think fast, talk fast, fight smart, which stress the many opportunities you have to deter or defuse a criminal encounter and how to use your brains instead of your muscles in a fight. Look for the new book information or sign up for Susan Bartelstone's personal safety seminars at www.fightsafe.com today. Have you ever thought about having your own internet talk show? Well, if you said yes, then click About Us. Then click Be a Host to get more information. Or just call Jeff Spinard at 480-294-6417.
Say that again?
480-294-6417. VoiceAmerica.com.
You're listening to Crime Prevention 101 with Susan Bartelstone. We invite you to share your stories, tips, or suggestions for topics you'd like us to cover, and Susan will address some of these on future shows. Send your story or idea to solutions@fightsafe.com. That email address again is solutions@fightsafe.com. Now back to Crime Prevention 101 with Susan Bartelstone.
And welcome back, everybody. And I am speaking with Dr. William Zangwill. We were talking about some of the symptoms of post-traumatic stress disorder, and PTSD can be absolutely debilitating. Correct, William?
Yes, absolutely.
I mean, it would just really prevent healing and all sorts of, as you're saying, drug abuse, all sorts of things that can result from this.
Well, Susan, when people go through a painful experience, I mean, there are two things I'd like to mention. One is that most of the people recover on their own. You don't even diagnose PTSD until after 30 days after the event.
Oh, really? No, I didn't know that.
Right, absolutely. The body and mind have an amazing ability to heal themselves. And with the support of friends, family members, and so on, a lot of people go through horrific things and come out fine. So I don't want your listeners to worry that if and when something horrible happens, it means they're doomed for this to develop. But with some people, it does happen. And after those 30 days, the symptoms persist. And essentially, a lot of the symptoms we talked about, the numbing, the painful, intrusive thoughts, the depression, sometimes, as you said, the increase in alcohol or drug use in an attempt to, get past this, the nightmares and so on, it's an effort basically to try to cope with the pain of the event that happened that was so horrific.
And this can be triggered, symptoms of PTSD can be triggered even years later by something that just brings you right back to that incident.
Absolutely. One of the examples we talk about when we're using EMDR is that if you were beaten or you were severely hit in a certain area of your body, years later, even when you're with a loving, caring partner or getting some body work or so on, a touch in that same area can re-stimulate the events that happen and as if they're happening in the moment.
Very powerful symptoms, true.
Exactly.
All right, now let's talk about how EMDR deals with this. Now, I know you worked extensively with Dr. Francine Shapiro. Can you tell me a little about EMDR and how it originated?
Well, in terms of EMDR, what EMDR does, I think, better than almost any other therapy is it connects what we know to what we feel. And that's the essence. There have been an amazing number of brain studies at this point that show we literally process intellectual material in a different part of the brain than we process emotional material. And what that means is 10 years after an event, 20 years after a painful event, you can know intellectually that you did the best you could, that you're safe now, you're fine. But the emotional part of your brain can still be terrified. And for reasons, quite honestly, we don't totally understand, what EMDR seems to do is take the knowledge you have now, that you're stronger, you're safer, that you have people around you who can help protect you, and connect it to those painful emotional events and help heal some of those wounds. And Francine Shapiro, the originator of EMDR, reports really essentially having a spontaneous insight back in the mid to late 80s, where she was walking and really suddenly realized that some troubling, emotional, painful memories she were having were no longer painful. She didn't know why, but what she noticed was that her eyes had been moving when she was thinking of this formerly painful event. And so serendipitously, she noticed this. She then tried to do it consciously, by bringing up some painful material, moving her eyes back and forth, and found that, once again, the pain of the event disappeared. And
that's astonishing.
It is. No, she is an amazing person, and she took that insight and through an amazing amount of hard will and determination started going out in an attempt to help others. So she went to clinics that had rape victims, that had at that time Vietnam veterans, people who had had something horrific happen to them and were stuck, in the emotional pain of it. and has repeatedly found, and further research has supported that when used properly with many people, not everybody, but with many people, it can be incredibly helpful at reducing the pain and the self-blame that often accompanies trauma.
So this is a series of structured eye movements?
It can be. Well, it's interesting because, as you mentioned, it is eye movement desensitization and reprocessing. But
which is a mouthful.
Yes, it is. Yes, it is. What we found over the years is that any kind of alternating stimulation from side to side seems to be very, very effective. And this was discovered many years ago by someone who had a client who was visually impaired and couldn't move their eyes. So they did alternate tapping, sometimes with their hands, sometimes with people's knees, and alternating tones from one ear to the other. There have been a variety of stimulation that seems to be very, very effective in reducing the pain of trauma.
And do you use a variety of these things in your particular practice?
Yes, because what any good clinician knows is that people are individuals, and what you want to do is find what fits best for that individual. And as one of my sisters mentioned, it's like good accessorizing. And really tailoring it to meet that person's level of comfort, their need, because people respond differently. So some people respond better to eye movements, some respond better to having their hands tapped, some respond better to sounds. And what you want to do clinically is find out what does that one person want and what works best for him or her.
Oh, that is amazing. I'm kind of learning this all myself here now.
Oh, good.
Let's compare this to the traditional kinds of therapy, because you're a clinical psychologist.
Right.
How would you compare this to what traditional therapy does, and why does it work so much quicker?
Well, first of all, people have been helped tremendously by traditional therapies. I don't want to badmouth other approaches, even though Emdr is incredibly powerful. But I think the reason it works better is twofold. Number one aspect of Emdr that many other therapies leave out is making sure that when a person has a painful memory, you access the material in a very rich, vivid way. So you have them, for example, bring up the most painful image of the scene that happened. It could be their assailant's breath, as they're lying on top of them, or the knife against their throat. It could be the sound of the glass shattering if they were in an automobile accident. So you have them bring up the material in a very vivid way, either the images they have, or the sounds, or the smells from the event, or all of the above. You also have them, and this I think is an important aspect of EMDR, is bring up the negative thoughts they have about themselves. And this is something I want to make sure we talk about, because as painful as the trauma is, when you're working with individuals, almost equally painful is how victims often blame themselves. So you want to access that material, you want to get in touch with the emotions they're feeling and where it's resonating in their body. And that aspect of EMDR, in terms of bringing the material up richly in so many different dimensions, is, I think, one of the keys to its effectiveness. The other aspect is it does add this bilateral stimulation that seems to make a difference. And as I said, there's been speculation as to why it may work, but we don't know for sure. But there's some interesting theories about that.
How long is there like a standard, we know that maybe traditional psychotherapy could go on for years. Is there kind of a standard length of time that most people would start responding to EMDR as opposed to a more traditional method of therapy?
There's been some research that suggests that with a single event trauma, with a one-time event that had a beginning and an end, people can do very, very, very deep work in 6 to 12 sessions.
That would be like a one-time assault, an attack, a crime,
exactly.
A crime scenario, not a Vietnam War veteran or something.
Well, the problem is that with Vietnam War veterans who were in combat for, in many different situations, for some of your listeners who unfortunately have been assaulted more than once, what I find much of the time is that there's a connection to previous events. After the Trade Center, a number of us volunteered to do pro bono work for some of the victims who were there. And what I found, Susan, in almost every case, unfortunately, were was that the memory of the event they had seen, the witnessing, the horrific things of the bodies falling or whatever it may be, the helplessness they felt, often connected to earlier memories. Mm-hmm. So one client, for example, I had saw somebody falling. It turns out that was not his friend, but it turns out he lost a friend in one of the buildings, and it went back 10 years to his fiancée at the time had been killed suddenly in an automobile accident. So the recent trauma not only was painful in and of itself, to losing the friend, but also it stirred up the old memories of the sudden loss of his fiancée. And in both cases, he said, suddenly my world was shattered, and I had no control. So in situations like that, when there's been multiple traumas or multiple events, the therapy is going to take longer.
But it still will not be as long as it could be with more of a traditional psychotherapeutic.
Most of the time, you're absolutely right. You're absolutely right. It's still, I've been doing this for 18 years now, and it still feels like magic sometimes. But not, again, not with everybody, but at times it just feels great. Even, 6 to 12 sessions, I think that's amazing to me. And no drugs or anything like that. Most of the time, no. But, again, if somebody has a deep depression, if they have a biological tendency toward bipolar disorder and so on, medication can be a really helpful adjunct. So this will work with people who have bipolar or other kinds of diagnosable conditions? Absolutely. Not just trauma? It absolutely can. It absolutely can. Really? Oh, good. We're gonna talk some more about that. Okay. Is this covered by insurance, by the way? It's psychotherapy, and as you mentioned in your introduction, there's been a significant amount of research. So if the person's policy covers psychotherapy, most of the time it covers this. We have had reactions, insurance companies are insurance companies. Some insurance companies have asked for EMDR when it comes to people suffering from PTSD. Other companies still claim it's too experimental, despite all the research, and, don't pay for it. But typically, it is psychotherapy, and if the person's policy covers psychotherapy, they should be covered most of the time. That is very encouraging. I'm really thrilled to hear that. Indeed. All right, now I want to talk a little bit about who is and is not appropriate for EMDR therapy. Mm-hmm. I think we may be coming up on a break. So you know what? Let's take our break now, and when we come back, let's pick it up there. Okay? So stay tuned, everybody.
Ask the experts. Call toll-free right now, 1-866-472-5787. And ask our All-Star team to answer your question. That's 1-866-472-5787.
Thank you for calling.
VoiceAmerica.com. After more than 17 years' experience teaching safety skills to thousands of women and men, crime prevention and personal safety expert Susan Bartelstone concluded that by thinking and responding quickly, ideally within 20 seconds, potentially violent criminal encounters can be prevented. Using techniques from many different disciplines and illustrated by 60 real-life examples and success stories, Susan shows how it's done in her new book, Think Fast and Prevent a Violent Crime, How to Respond to Danger in 20 Seconds or Less. Check out www.fightsafe.com for more information. You'll also find information there on Susan's upcoming Crime Prevention 101 personal safety teleseminars. Think fast, talk fast, fight smart would stress the many opportunities you have to deter or defuse a criminal encounter and how to use your brains instead of your muscles in a fight. Look for the new book information or sign up for Susan Bartelstone's personal safety seminars at www.fightsafe.com today. Talk, talk, talk. That's all we do is talk. If you'd like to talk, call us toll-free right now at 1-866-472-5787. 1-866-472-5787.
That's it.
VoiceAmerica.com.
You're listening to Crime Prevention 101 with Susan Bartelstone. We invite you to share your stories, tips, or suggestions for topics you'd like us to cover, and Susan will address some of these on future shows. Send your story or idea to solutions@fightsafe.com. That email address again is solutions@fightsafe.com. Now back to Crime Prevention 101 with Susan Bartelstone.
And welcome back, everybody, to Crime Prevention 101. And I'm here talking with Dr. William Zangwill about EMDR therapy. Now, William, let's talk a little bit about who is and who is not appropriate for EMDR therapy.
Sure. Let me answer that. Let me talk about who's not appropriate.
Okay.
What EMDR does therapeutically, it's like stepping on the gas, and you go faster most of the time. But if you've got people who are already it feels like hanging on the side of the cliff by their fingernails, what they may need is actually go more slowly. Mm-hmm. Now, there are aspects of EMDR and their method, there are different ways of implementing EMDR that can adjust to that. But for people, for example, who are doing self-injurious behaviors, who are cutting themselves, mm-hmm. Who are suicidal, basically, as I said, who are sort of hanging on to the side of the cliff by their fingernails, EMDR can be overwhelming at times.
Okay.
For people who have a current severe substance abuse problem, many of them have a trauma background and could definitely benefit from EMDR. But oftentimes what happens is for those who use substances to numb themselves, what EMDR does so powerfully is to bring things into our awareness. That's one of the reasons we think it works. So if someone is, actively using substances, there's someone out of control, going through the trauma treatment can actually increase the urge to use because it brings up, temporarily more pain, more awareness. And the last group that I would hesitate with, people who are psychotic, people who are, hallucinate and so on, you would not want to do it with. And the last group is if you've got people in the legal system, they need to, be concerned about, actually the next to last group, be concerned about would this affect their case, would it affect their testimony and so on. So they would need to check with their legal representatives, in terms of would this disqualify them, would it affect their credibility as a witness and so on. The other group are people who might have some medical problems. If you've got an 80-year-old person who has a history of heart, disease, you may not want to relive a trauma when they were 5 that would get their whole body, their heart accelerating and everything else. Oh,
because that can happen?
Oh, absolutely. No, Susan, one of the most fascinating things about this is that when you bring up these painful memories, and you stimulate the material effectively, people oftentimes can feel as if they're experiencing it again. And the value is you take them through it and take them safely through the other side so they can feel, on a heart level, on a gut level, that they're safe. But while it's happening, I've seen, people will sweat, they'll turn red, they'll talk about their heart racing. I've had people tell me that when we dealt with some memories of physical abuse, for example, the area of their thigh where they may have been hit by a belt started tingling. So if you've got someone, if you've got somebody in the early stages of pregnancy, for example, where a lot of fetal development is controlled hormonally, if you've got somebody, as I said, who has had some heart problems, it doesn't mean you shouldn't do EMDR, but you want to make sure you take good care of your client and, check with their doctor and make sure it's a safe procedure for them.
So it's really important that that the people that are doing this work have a clinical background, would you say?
Yes.
So that they can...
We only train people who are licensed clinicians.
I see. Great.
Dr. Shapiro, to her credit, when this was, just coming out and people were incredibly excited about it, there were people calling all over who wanted to do this as a technique. And her concern then and her concern has always been making sure that we protect our clients, our patients, and that only people who can look at the person as a whole, not just as somebody who had a trauma, are using this.
Excellent point, yes, because I can see it could stir up a whole hornet's nest of stuff if you don't know what you're really dealing with.
You're absolutely right.
Now, do you also treat secondary victims of, if you're dealing with just let's say an assault or that kind or crime trauma, do you deal with the husband and the wife? Because I know you talked about family therapy in your practice.
Sure.
Does this figure in, and would this be recommended? Because as you know, and I hope those out there listening might know, there's not just one survivor of a crime. Everybody that's around that person, that's in an intimate relationship with that person, is now also a survivor.
No, absolutely. In fact, sometimes it stirs up more for them than the actual victim. So any good clinician is going to do a thorough assessment, and EMDR has been very, very helpful for situations that are called vicarious traumatization.
That's the word. I knew there was a word for that.
I hope it doesn't sound too jargony, but it really accurately describes what happens. Sometimes just by witnessing, what hearing what people have gone through. For your more sensitive people, that alone can be enough to really be somewhat disorienting and very, very painful. Or what it portended. Sometimes a person was in an accident, they survived, but yet the loved one realizes how close they came to losing them and can start developing some obsessional thinking or some intrusive thoughts, repeated nightmares, and so on. So what I talk to people about is EMDR is good basically in two areas. One, where people have been through specific trauma, such as you delineated earlier. And the second area is where there's a discrepancy between what you know intellectually versus what you feel. And I think most of us, when I'm training people, I'll often ask the group to raise, to have people raise their hands who've ever been attracted to someone they shouldn't have been attracted to.
My hand is up. Okay?
Unfortunately, Susan,
Two hands are up.
So is mine. And the reason that happens to us...
I bet Harry Potter, my beautiful engineer's hands are up.
Probably both hands in Harry's case.
Both hands.
But the reason that happens is not because we have a self-defeating personality disorder or that we're masochistic. But as I mentioned earlier, we literally, again, emotionally process material in a different part of the brain than we do intellectually. So we can have very strong beliefs, very strong ideas of who we should be with or what we should do and so on, and not really have control over whom we're drawn to. So EMDR is incredibly helpful where that discrepancy exists. The person who was abused as a child and yet blames themselves, because I should have told someone. They were 5 years old. They had a parent who was not even, was purposely not noticing what was going on and so on, but years later they're still blaming themselves. That's an example of what I mean by that discrepancy between what they know intellectually. They've read the books, they've watched Oprah, but they're still stuck emotionally.
Exactly right. They haven't fully gotten all those buried things up there to process. And
haven't been able to accept themselves for who they are. So that's another area, you would not call trauma necessarily, but where EMDR has been incredibly helpful.
And I want to really emphasize this, that there are secondary survivors and victims to any kind of traumatic incident that happens. If it happens to someone that you're intimately involved with, you're affected by it. And you really need to be on the alert for some of these symptoms of PTSD yourself. And, so I was talking with a friend about the show coming up, and she was saying, she's a mental health worker, and she said she is getting burned out dealing with other people's traumas. And I think that she would be, I said, I think you're probably going to be a good candidate for this. You probably would just need a couple of sessions to get at this stuff. And, family members who, again, of assault or murder or suicide victims, or those people that discover someone who was murdered or committed suicide. Someone wrote me a letter about that, an email. Emergency service personnel. You were talking about working with people that were, I guess, first responders at the 9/11 tragedy. Emergency service personnel, police officers, any first responder who day after day witnesses trauma after trauma. These symptoms could be accumulating in there and can cause, I guess, a lot of maybe self-destructive or, behavior that could be dealt with EMDR.
Susan, you're absolutely right. In fact, years ago, a colleague of mine who was head of the EMS in New York, head of the mental health division, and she had done a study with some colleagues, and they found that with the first responders and the emergency service personnel, it was only a matter of time until the stress of their job, the horrific things they had to see and deal with, affected them. Even the strongest person, if you put them in that situation repeatedly, for some it was after a few years, for some it was more, but for almost every single person they looked at, to be in that situation time after time after time, it affects us. And so you're absolutely right.
So I'm really hoping that maybe some of the people out there that are listening to this that have the ability to consider this option, if you're working in that area, take heart on this. This is really important to recognize before you do get burnt out, like my friend was telling me.
That's a good point.
Now, I also want to talk to you. In your bio, it mentions that you combine EMDR therapy with meditation.
Right.
Now, would you talk a little bit about how that works?
EMDR is incredibly helpful at dealing with specific aspects of trauma. I had a rape victim a while ago who had been raped 12 years before by a stranger, hid in her closet, came out, and 12 years later she could still feel the pressure of the duct tape he had put over her eyes. And she was this amazingly open woman. We did some very powerful work, and because of her strength and her openness, in a very few sessions, she reported, she said she couldn't feel the tape anymore. She could not feel it because we had processed that emotional pain.
Oh, that's outstanding.
I'm sorry?
That's outstanding.
No, it was just, and again, it was mostly due to her and the process. But what it didn't deal with her was, why did this happen? And what I found, what I find in using mindfulness is that it does two things. It helps the person to more deeply look at what this is stirring up for them, and especially most mindful practice has a built-in component of acceptance. I'm not a Buddhist, but there's a wonderful message, the Buddha said was one of the most painful, or one of the most important causes of suffering is people wishing things to be different than they are. So in our mindfulness work, one of the things I do is basically look at, unfortunately things happen in life sometimes, and people find it oftentimes very comforting.
I understand. All right, hold that thought, William. We're going to take another break. We're going to come back. I want to talk about vulnerability and blaming yourself for what happened. So stay tuned.
Have you ever thought about having your own internet talk show? Well, if you said yes, then click About Us. Then click Be a Host to get more information. Or just call Jeff Spinard at 480-294-6417.
Say that again?
480-294-6417. VoiceAmerica.com.
Hello, we're Mike and Susan.
Hello, I'm Catherine.
We are the March of Dimes 2008 National Ambassador family. Although Catherine was born extremely premature with many challenges, today she is a healthy 5-year-old thanks to the March of Dimes.
I'm Don Germano, Senior Vice President of Kmart Stores. Kmart is proud to support March of Dimes' mission to help moms have full-term pregnancies and healthy babies. Please make a donation at any Kmart or at marchforbabies.org so that one day all babies are born healthy.
After more than 17 years' experience teaching safety skills to thousands of women and men, crime prevention and personal safety expert Susan Bartelstone concluded that by thinking and responding quickly, ideally within 20 seconds, potentially violent criminal encounters can be prevented. Using techniques from many different disciplines and illustrated by 60 real-life examples and success stories, Susan shows how it's done in her new book, Think Fast and Prevent a Violent Crime, How to Respond to Danger in 20 Seconds or Less. Check out www.fightsafe.com for more information. You'll also find information there on Susan's upcoming Crime Prevention 101 personal safety teleseminars. Think fast, talk fast, fight smart, which stress the many opportunities you have to deter or defuse a criminal encounter and how to use your brains instead of your muscles in a fight. Look for the new book information or sign up for Susan Bartelstone's personal safety seminars at www.fightsafe.com today. News, opinion, passion. Your voice counts. Call toll-free 1-866-472-5787. 1-866-472-5787. VoiceAmerica.com.
You're listening to Crime Prevention 101 with Susan Bartelstone. We invite you to share your stories, tips, or suggestions for topics you'd like us to cover, and Susan will address some of these on future shows. Send your story or idea to solutions@fightsafe.com. That email address again is solutions@fightsafe.com. Now back to Crime Prevention 101 with Susan Bartelstone.
And welcome back, everybody. And we're talking to Dr. William Zangwill about this amazing innovation in therapy, EMDR. And we spoke earlier that with victims of violence, and especially if it's of a sexual nature, you're concerned with two issues: vulnerability that the survivor feels, and guilt and shame. Just a few comments on that, if you will.
Okay. The vulnerability is, the most common aspect that people focus on, because people's assumptions that the world is safe, that I am safe, that people won't do horrible things, literally gets shattered. That's a perfect target for EMDR, and people usually respond very quickly. A more pernicious result of traumatic experiences oftentimes is the person blaming themselves, either for what they did or for what they didn't do. I had a client one time who had been traveling abroad and was jumped by three men and, assaulted and robbed. And there was a part of him that felt like some superhero. He should have been able to fight them off. And this showed what a weak person he was. I've had people, and especially when there's been long-term sexual assault by a family member, by a relative, people often feel a tremendous amount of shame and guilt. And it's something that's very important, that's, to be worked on. It's an aspect of EMDR that is highly stressed. But honestly, it's harder. It is harder because people often have these deeply held beliefs that, I'm tarnished, there was something wrong with me. Because being that we're human, and this is, a very difficult thing for people, is that in these situations, people can feel sexual pleasure, for example. People can respond, and we know that that's because of how the body is wired. Infants at birth can respond to stimulation. All the wiring is there. But people see that as a result, and sometimes this is imposed on them by their assailant. See, you're responding. See, your body is responding. This must mean deep down this is something you really want. And people will carry that message and use that to beat themselves up.
I am so glad you mentioned this, because this is very little discussed and critically important.
I agree.
What? I don't hear it mentioned almost nowhere, and so I'm just thrilled that this point came up. One of the things that I always say on every show, and I don't know if you know that I'm in addition to being a crime prevention lecturer, I was also a self-defense instructor for many years, and people would come to me. I've heard these stories forever, and I always tell people, and I always mention in the show that for any survivors out there, especially if you're a survivor of the kind of crime that I'm talking about, please understand that nothing that happened to you was your fault. Even if you think you used bad judgment and put yourself in a situation where you became vulnerable, that is not a justification for a crime. And that the fault is always on the person that committed the crime. But it's one thing, as you said, to know it, to hear it, and right. Another thing to believe it. And especially if you did have that reaction, you're gonna that guilt and shame is going to be very difficult to get at. And I'm really thrilled that.
Well, pardon me for interrupting, but one of the important aspects of EMDR is that when we have people go down, we always ask them how they're labeling themselves in a negative way, because people always do. I'm helpless, I'm vulnerable, I'm defective, I'm damaged goods, whatever it may be. But part of the program, part of the EMDR protocol is designed to ask them, so even though this happened, what would you like to believe about yourself? And the way I phrase it, and the people I work with and train and supervise, is what we're looking to do always is help the client to judge themselves more fairly. And by that, we have said, great, so even though this happened, what would you like to believe about yourself now, moving forward, and not hopefully helping them be less stuck in the past?
excellent, fantastic, insight into this, and I really love the framework that you put the EMDR therapy in. I know you have to go off to your conference. Is there any final thought, the final thing that you'd like to say to the audience before you go?
Susan, just thank you for this opportunity. It really, again, not to overpromise it, nothing works for everybody, but this is incredibly helpful for most people. And so if you're recognizing yourself or someone you care about in this situation, I strongly encourage people to give it a try, but just make sure they give it with somebody who's been well-trained.
Well, I'm going to make sure I give lots of resources where people can find an EMDR practitioner.
Great.
And I'm going to let you go to your conference, and thank you so much for being on Crime Prevention 101.
Susan, I enjoyed it. Thank you so much.
Okay.
Bye-bye.
Bye-bye now. All right. Now, for any survivors that are listening, whether or not you want to try EMDR therapy, just remember it's really important to find some kind of therapist, because healing can be pretty much impossible without some therapeutic intervention over the long run. And on my website, dearsafetysolutions.com, I'm going to be posting a tip sheet, which is entitled Resources for Finding Healing Help. And on that tip sheet, I'm going to give you a list of referral organizations and websites that's going to help you find many different kinds of therapists, inpatient programs. I've got support groups, hotlines, resource information. Quick tip, interview at least 3 therapists and before you choose one, because you want to make sure you've got the best fit that you can before you make a commitment to that therapist. And during the interview, ask what area the therapist specializes in. Ask if there are any topics that they're uncomfortable with, such as religion or lesbian, gay issues, if that's a concern for you. As always on this show, no absolutes exist in a crime scenario, and no advice I can give you is going to address every variable. You're going to have to analyze each situation on its own merits and respond the way that you instinctively judge is the best. But it's my aim on this radio show to provide you with the information and options that is going to help you make that instinctive assessment quickly. And I hope that this show today is going to prove as useful to you as I think it is. I was just blown away by it. Now, for those of you who have missed past episodes of Crime Prevention 101, all you have to do is go to my host page on the voiceamerica.com website, and all my past shows are archived there. And I just recently set up an easier way, because sometimes it's a little hard to follow those links. So you can go directly to crimeprevention101.com. And that's going to take you directly to my show host page. So that would be either voiceamerica.com, and you have to plug my name into the search box, or go directly to crimeprevention101.com, and all my past shows are going to be archived there. You're also going to find show notes on my website. For each show, I've posted notes on dearsafetysolutions.com. And the show notes for the show today, Healing Through Alternative Therapy, I'm going to have a link to Dr. Zangwill's website, and he's got lots of interesting articles that he wrote and books on his website, so you should really take a look at this. This is www.emdrandtraining.com. And he's got also www.emdrandmeditation.com. And by the way, I'd like to say, I think meditation, I've been a meditator for many years, and it has totally helped me dealing with all of the survivors that I've dealt with and with the incidents that happened to me. It was just amazing. I've got also links to give you more information about EMDR and how to find an EMDR practitioner on there. You got the www.emdr.com. And don't forget, I've got safety tips on my dearsafetysolutions.com website. Also, remember, if you've got a question or a comment on today's show or any of my shows, or a safety concern, just email me at solutions@fightsafe.com or go post your question on my Dear Safety Solutions website. Next week, we're going to continue with the theme of healing from crime trauma or sexual assault, and I'm going to be talking about self-defense and martial arts as a healing modality. Yep, that's right. I said healing. And you know what I always say, it'd be a crime not to listen. So stay tuned and stay safe.
We hope you got some useful information and inspiration this week on Crime Prevention 101. Susan Bartelstone invites you to join us again next Saturday at 11 a.m. Pacific Time and 2 p.m. Eastern Time here on Voice America. Have a great weekend and a safe weekend.